Good morning and welcome to the first Channel 3 Consulting webinar. I'm Eleanor Rollison, I'm a partner at Channel 3 Consulting, and I'm delighted to be joined this morning by Scott Haldane, who's the CFO at Cambridge, who's CFO and currently the acting Chief Executive at Cambridgeshire and Peterborough NHS Foundation Trust. Just by way of background really, the chat is open, so please put questions and chat into the conversation. We won't actually be picking that up as part of the webinar, but we will pick that up afterwards, and if you want to ask Scott anything or any of the team at Channel 3, please just put that into the chat. So by way of introduction, I'll just provide a little bit of background to me, Eleanor Rollison, partner at Channel 3 Consulting, a little bit about Channel 3 Consulting, and then I'll introduce the work that we've done with CPFT and Scott Haldane. So my background is I've worked in and with the NHS for the last 30 years. It's been a career of two halves, 15 years spent in the service, initially as a clinician, NHS management trainee, and then in various management roles. And then the second half of my career has been spent in healthcare advisory, the last 5 of which have been at Channel 3 Consulting, where I've been able to make my passion for transforming health and care services through digital come to life. So a little bit about Channel 3. Channel 3 Consulting, we're a specialist digital healthcare consultancy, and we work across healthcare and local government. And we support organisations and individuals actually to lead better lives by supporting organisations to be able to deliver better care, and we do that through supporting and enabling better digital services. We work across acute, community, mental health, local government, all services, and we work with all of the clinical system suppliers and a whole range of technology suppliers. Core business for us is supporting organisations in implementing the technology, and we support organisations through the entirety of that journey, from developing digital strategies, from developing business cases, getting ready through procurement, implementation and onto optimisation. And sadly, where people haven't got it quite so right, we can also help to put things right and get people back on their feet again. And now moving on to the relationship with CPFT. CPFT was one of our really most challenging but most enjoyable clinical system implementations. We started our relationship with CPFT way back before COVID was even a thing in 2019 and supported Scott and the team to get the business case across the line, and then through procurement or through direct award, and then also through to readiness and implementation. So as part of the webinar today, what I want to do is to introduce Scott in the first instance, and then explore some of our experiences and lessons learned in implementing the EPR with CPFT. Now Scott, I always say, is one of my favourite clients and he is, because he's quite an informed client. He comes, he knows exactly what it is that he wants and what he doesn't want, and also how we can work collaboratively together. And as a result of that, we developed a really strong strategic partnership between Channel 3 and CPFT, which we'll explore as part of the webinar today. But Scott, if I can just hand over to you in the first instance and just ask you to provide a little bit more about your background, because it's really strong background.
Thanks, Eleanor, and morning everybody. It's a pleasure to be here. I've been in the NHS off and on since the early 90s, primarily as a finance director. I did have a brief sortie back into the private sector, but I started out in NHS Scotland, and today is actually an anniversary. I came down to Cambridgeshire and Peterborough 9 years ago today, and took up the role as the Director of Finance at Cambridgeshire Community Services. I'd worked quite extensively with the NHS in England as a past president of HFMA, but I never actually worked in the service. And when someone asked me about the possibility of coming down, I thought, well, why not? Something I haven't done before. So I came down and then was with CCS for a couple of years, and actually come the 1st of January 2022, that'll be 7 years with CPFT. And it's been fantastic. It's a different environment down here. There's some measure of amusement from someone who comes from NHS Scotland that the English system seems to be moving very much more toward the kind of model that NHS Scotland has had for many a year. But the importance of the relationship with Channel 3 and what we were trying to effect through the implementation of our single EPR across the trust was an incredibly enjoyable experience for us as well as being informative. But the most important thing is it helped us deliver the outputs and outcomes that we were expecting when we set out the business case back in 2019. But I'm sure we'll cover a lot more of that as we go through the conversation.
Well, congratulations. I'm sure
Thank
we'll
you.
have a celebration.
Yeah.
Fantastic. So the strategic partnership, we've developed a strategic partnership with a number of our clients, and that's because it's really important from a Channel 3 perspective that it's not just a commercial relationship that we have with you as a client, and obviously there are benefits to having the commercial advantages of the strategic partnership. But it goes way beyond that. It's about how the organisations work together. So it'd be great to hear from you and from a CPFT perspective about why it's not a commercial relationship, the strategic partnership, but why the strategic partnership particularly worked for you.
Okay. As you said, the relationship goes back to 2019, and in fact, if you recall, it was in this very building that we first met as two organisations. And when we'd set out our business case, we were very clear that the business case and our sense of ambition wasn't about just a technology implementation. It was about a cultural change, a behavioural change, and just to set the scene for the benefit of others. As a trust, we already used, System One was the chosen product. We already used System One quite extensively across the trust for many of our services. It was also the predominant system being used in primary care, and as a community and mental health provider, the ability to potentially share more information between primary care and ourselves was clearly a major area of interest for us. So we decided we were going to replace our existing mental health system with System One, so that System One therefore became our EPR for the entire trust. But as I say, it wasn't just about lifting one out and putting another product in its place. The whole idea was to then use that platform to ensure that we were acting and operating in as effective and efficient a way as possible across the whole trust. So therefore it became, as I say, a cultural behavioural focused programme. And when we met in this building, one of the things that attracted us to you guys prior to that conversation was the experience that you'd had elsewhere. And you said, I think very gently in passing there, you also had experience of stepping into such implementation programs that weren't quite or hadn't quite gone as they might have hoped. And we wanted to avoid that. We wanted to ensure that we were investing in a sense of partnership with someone who understood what we were trying to do, and not just about the technology. So when we met in this building, I think what became clear was that sense of empathy and understanding with what we were about. It seemed to strike, our values seemed to strike a chord with your values, and just the general chemistry between the people who met, and that kind of sense of it wasn't just about, as you often see with consultancy, with all due respect to other consultancies out there, that often you get somebody who comes along, sells you the potential of what they can offer, and you have a relationship with them and they disappear. What we saw on that day were the same faces, the same people who continued that relationship, and I think that's been borne out over the piece. And again, I'm sure we'll talk about that as we go forward. But it was about the kind of sense of chemistry, the sense of empathy, the sense of insight that you could bring, which was more than just how do we implement System One in our mental health services. It was about what would that then do, or what would that then provide us with by way of a platform to start to transform and invest further in digital innovation. And again, that's placed to your strength.
Yeah, absolutely. And for us, I think the strategic partnership made such a difference from a COVID perspective.
Yep.
Lots of other programs of work, as soon as we hit COVID, then put the brakes on. And actually, I think as a result of the relationship that we developed and the confidence that we got in each other, that enabled us to be able to, carry on and really sort of crystallise what we needed to do through COVID.
Yeah.
So the strategic partnership lives on.
Yeah, and I don't know whether it's significant. It's certainly to others, but it certainly was for me. I remember receiving, and we'll talk again about what happened over the course of the last couple of years, but I remember receiving a letter from one of your colleagues just expressing thanks that we didn't just say, when COVID hit, we're stopping things, because it meant that you as an organisation were then able to keep your staff and the contractors that you used, keep them in employment through the COVID period. And actually meant quite a lot that someone would take that time and trouble to recognise that we'd stuck with the task at hand, we saw the importance of it, and whether it was by a conscious decision or not, we'd actually helped you guys out as well, which plays back to the sense of partnership.
Yeah, great. So that's brilliant. Thank you, Scott. So I'm just going to move on now to the focus really of the webinar, which is around sharing some of our experiences, the highs and the lows and the challenges and the fun and the quizzes from the supporting the implementation.
I never won a quiz. I thought somehow someone might conspire to let me win, but I never won.
So what I'll do is to take us through the 5 top tips that we've shared with everybody as part of the outline for the webinar. So initially, the first really topic is around strategy. And as I've said, you had quite a strong strategy. You were quite clear on what you wanted to achieve as an organisation. Could you just talk us through some of the background behind that strategy and why you went for System 1 and then the procurement, how you were then able to procure System 1 and then continue with the journey, and then perhaps if we can reflect on what that then means now from an ICS perspective and the strategy from a digital strategy from an ICS perspective.
Well, we'd spent, if I start with the kind of strategic context, we'd spent a fair bit of time reflecting on what kind of organisation we wanted to be from a technology and information perspective, and we reset our digital strategy accordingly. One of the key features of that was a sense of wanting to be an agile organisation. And with hindsight, looking back what's happened over the last 18 months, that was clearly a very enlightened thing to have done, because we were able to provide tools and technology to our staff to work in a very agile way that when COVID hit, it meant not only could we continue with the work we were doing with our System 1 implementation, but people were still able to work across the organisation in much the same way as they had done when they were office-based. So to say that was a bit of a blessing, and I know some of my colleagues would like to think very, as I say, enlightened and impressive decision to have taken way back when. But in addition to being an agile organisation, as I said earlier, we wanted to be an organisation that had a single EPR and was very much about the information. It wasn't about the technology. It was what the information, what the processes that we were looking to implement consistently across the organisation would mean in terms of how we delivered safe, effective and efficient services to the good people of Cambridgeshire and Peterborough. So, given that we'd already had System 1 as I said earlier, our kind of main EPR for all but our mental health and some of our cross-cutting services, the decision was a relatively straightforward one. If you're going to go for a single EPR, you might as well use the one that you're most familiar with. And we did look at whether the mental health EPR that we had could in fact cover our community and children's services, but that didn't seem to be as viable an option as looking at the System 1 option with its capability for mental health. So that was a relatively straightforward decision to have taken. And given that we already had an existing relationship with TPP, as you say, through direct award, it was, again, a relatively straightforward process to extend that relationship to include other services and clearly by association, other staff across the trust. So once we'd made those decisions and that was consistent with the context of the digital strategy, it was then a question of, okay, let's make the business case stack up in terms of what we're looking to try and do with all of these ideas, and then how do we make it happen? So that's what we basically did in May 2019, and then we set out a program plan associated with all of that, which would chunk it into manageable elements. So we effectively set up a program that was going to be over three phases. As I've said, we had our old mental health platform in children's services, as in some aspects of our community services where we have older people's mental health, and then the mainstay was in our adult and specialist mental health services. So we did things in that order so that we could learn from our experiences over the 3 phases, and then by the time we got to adult and specialist, which was clearly going to be the largest area of impact, then that we were well primed, well ready to address anything, and then of course COVID hit.
Yeah.
So that's kind of that was the grand plan. Now, I mean, I don't know whether you want me to go on to talk about.
We'll talk about implementation later.
But that was the plan that we set out, as I say, way back in 2019.
Yeah.
And the board were fully behind the business case. They were fully behind the objectives within the business case, and the mere fact that it was consistent with what we had set out and they had signed up to, my colleagues and I, in terms of the digital strategy, we were all set.
Brilliant. And how has that now positioned you from an ICS perspective? Because obviously the landscape has now changed from 2019.
Well, we're working really hard within Cambridgeshire and Peterborough to help forge that ICS kind of philosophy of collaboration. I think it's fair to say, without telling tales out of school, Cambridgeshire and Peterborough has never really been a system that has worked very closely. Well, that's not strictly true. It has worked closely, but I'm not sure it's worked as effectively as it might by enhanced collaboration. And as I've said, I've been here now for 9 years, and even I, bearing in mind I've come from a single system background in Scotland, even I am now confident we're on the cusp of doing some really great stuff because we are collaborating.
Yeah.
So in terms of the System 1 implementation, and I keep wanting to call it One Vision.
Yes.
So I should say to people, that was the programme name that we gave. We ran a competition.
Yeah.
And if you remember, it was all about System 1, and I think the person who won I can't remember what the prize was, but it was a Queen fan.
Yeah.
So One Vision, aligning it to the vision for the organisation, the strategy.
Fantastic.
It was quite novel, but it's kind of set a tone for the nature of the relationship. Anyway, so I'll call it One Vision from here on in. So when we embarked on the One Vision programme, it was very much with a view to, as I said earlier, being able to share information more readily with primary care, as well as making information more consistently available across the trust, but with more than half an eye to the intended development of a shared care record to underpin what we're trying to do as an ICB across Cambridgeshire and Peterborough. And that's very much the kind of core objective that will help how we forge that sense of collaboration across Cambridgeshire and Peterborough.
Excellent. That's brilliant. Thanks, Scott. So moving on then to our second topic is around transformation versus IT.
Yep.
And organisations that we work with, more often than not have that ambition around transformation, but there's always a tension between, when it comes down to it, how much of it is really just then an IT deployment. So it'd be really good to learn from you. I know as you've already outlined that the organisation really wanted to transform services alongside the deployment of the IT. But given we had to do that in a COVID environment, how much of that transformation was achieved, and how much of it was an IT deployment on reflection, and how much more, how would you advise organisations? Because often we're asked by organisations, how much transformation should we expect to deliver as part of the implementation, and how much do we then do as part of optimisation then afterwards?
Well, we had a very heroic intention pre-COVID to see that as being an integral part of the programme. As you rightly say, the impact of COVID and what that meant in terms of how we had to work. We've had to park some of the optimisation, a significant proportion of the optimisation work, to be something that we did after the implementation. But what we were trying to do was we adopted, I suppose, pretty obvious, in some senses, transformational reviews of the processes that we currently had. So we did the classic, as is and to be, and we spent a lot of time working with our staff across the trust to get them involved, get that sense of buy-in from them, and ask them the obvious question: if you know what you doing daily better than anybody else, have you any thoughts about how you could do it better? What would help you better, or feel that you are better informed to do the job that you're being asked to do? Mm-hmm. How are you better informed to support the patients that you deal with? And indeed, on a back office perspective, how do we get the information out that will help us to plan services, to plan, how we use the resources that we've got to better support, again, the patients of Cambridgeshire and Peterborough. So we set all this out with, an ideal approach to seeing it very much as a transformation programme. We did a lot of that work, but then, of course, when COVID hit, we weren't able to have the sort of workshops that we planned to have. We did try to do a good number of them remotely. Didn't work quite as well as they had done when we were able to do, people in a room. And it's novel to be with somebody in 3 dimensions today. It's nice for a change. So we set all of that out, but the reality was then we had to park a lot of that stuff, and that then took us back to, okay, what do we do in order to ensure that we put the technology in, but still have more than half an eye on how we can change and improve the processes, even if we had to implement those after the fact. And as I said earlier, this wasn't just about our mental health services, it was about trying to engage with staff and colleagues who were working elsewhere in the trust, but not necessarily in the mental health service, who are currently using System 1. What were their experiences, and how should either those translate into what we might want to do in mental health, or alternatively, what we were planning to do with our mental health colleagues, what impact that might have for colleagues working out with mental health. So when we look back, and I know you're going to talk about this at the end, but it's quite an interesting, if not staggering, point of reflection. There are something like 450 lessons learned that we've logged across the 3 phases of implementation. Now, a significant number of those will be translated into improvements in the way that we provide the services, how we use the technology. Some of them are about project governance and that, but 450 lessons learned, I think, is actually quite an incredible recognition of the effort that was put in by the respective teams to make this a success, which we never said at the start. It has been a success.
Yes.
We should have heralded that at the get-go.
Excellent. And I think critical to the success of the transformation versus the IT was actually Claire as the SRO and the clinical leadership and how she galvanised the troops as well. So.
Yeah. She'll kill you and she'll kill me for saying that. But it was. Claire and I had a long conversation. Claire's an incredibly bright, motivated, passionate woman. And I was very clear that this wasn't, in terms of it being, as I say, a transformational change, this wasn't something I wanted anybody other than a clinician to lead. Because through that engagement, obviously we've got that sense of mutual respect that, with all due respect to colleagues, you don't often get if it's not on a kind of peer-to-peer basis. There was when we were thinking about all this, and when I was thinking about who might be best to lead it, I was drawn to a comment that our former medical director made to me when we implemented the mental health system, which predates me, but for those that are old enough to remember a very corny advert on the telly, she described the mental health implementation at the time as, "I can't believe it's not paper." And what basically she was meaning was they just took the paper processes and automated them.
Yeah.
And Claire's never been one for just kind of following paper. She's always looking for a better way to do something. She's our chief pharmacist, and she's very passionate about implementing, medicines management, EPMA, and it's about improving the efficiency and effectiveness of the processes, as well as making sure that we use the tools to best effect.
Yeah.
And as I say, the combination of her clinical background, that sense of passion and commitment made Claire the ideal SRO for this project, and she drove it beautifully.
As well as leading the vaccination programme as well at the same time.
She's been a busy lady.
No end to her talent.
Yeah.
Brilliant. So moving on then to readiness and implementation. So as an informed client, you were absolutely clear at the beginning. It's really important that we're ready to take this on. You knew exactly what you were facing. We often have conversations with clients about readiness and getting ready. And it's seen as sometimes as a nice to have, or as a diagnostic that's just an additional thing, and it's not necessarily going to tell them anything they didn't know. And reflecting on the readiness assessment that we did with you, I think your feedback was, you didn't tell us anything we didn't really know, but perhaps delivered it in a way that made us step up and think about what we needed to really do about it and how important it was. So can we just talk about readiness in the first instance and how that worked?
Well, I was going to take slight issue with you. It was reassuring that you reinforced some of the things that we already knew, and we'll pick up on elements of that in a second. But there were also things you told us about that either we didn't want to recognise or hadn't recognised. So if we look at the elements of the readiness assessment that you undertook, and I suppose before I do go into that in detail, one of the points of reflection for me was the formality and the objectivity of the readiness assessment is something actually a lot of programmes don't engage in beforehand. They think they know what needs to be done. They think they know the resources that they're going to have available, and they think they've got the expertise to be able to translate this into BAU. What you guys did was you came in and said, actually, these are critical measures to a successful program implementation or transformation program, and we just need to be clear about who's going to do what. And that for me was quite telling, because I'd already set out with you guys what I wanted was a blended approach, because I knew we didn't have, not a lack of skills, we just didn't have the lack of, we didn't have the lack of, it's programmer, we had a lack of skills resources that were available in breadth and depth at that point in time. So as picking a specific area of expertise, the configuration and testing of the application and how we wanted to see it work in the fullness of time we didn't have that in breadth or depth. We had skills, but we needed to complement that. So you guys were able to step up, provide us with that aspect of the programme, and then over time, we migrated that sort of blended team sheet so that it became more a responsibility for us, so that when you packed up your tents and went home, we had the skills inherent in the team, in the trust, so that as we started to look at other potential developments, those resources, those skills were already there. But going back to the readiness assessment, so as I say, just holding that proverbial mirror up to us around, did we have the strategic context, did we have the resources that we thought we might need? Had we gone through that sort of transformational piece? Did we understand the as-is, the to-be? And then were we kind of thinking ahead to what BAU might look like, and how that journey needed to play out was incredibly helpful and helped inform our programme plan accordingly.
Yeah, and I think it really helped us have the confidence to be able to carry on then through COVID, because we knew where the gremlins were, and we, owned the risks early, and it really helped. Yep. So moving on to implementation then, and the wilds of COVID and doing it in a remote environment, what are some of the reflections and lessons learned from implementation?
Actually, I'm struggling to come up with something that's more a sort of cautionary tale for anybody about to embark. Because I think, notwithstanding COVID and the frustrations as well as restrictions that imposed, actually, largely thanks to Claire and the team, and obviously your colleagues as well, it went very well. There were very few obvious hiccups. In addition to implementing the EPR, we also introduced the community hospitals module into our inpatient units from System 1 as well. So we were doing a couple of parallel projects. The former had started before we looked at One Vision, but many of the same resources were needed to do both. So there's maybe a salutary tale in there about just be careful how big the ocean is you're trying to boil. But actually, there was a good read across in terms of learning and also skills transference from what we were doing with the inpatient wards into implementing One Vision across the mental health. I think that part of the engagement, so having set out before when we were building the business case about what we were doing with our colleagues to try and get their sense of what they would ideally like to see from such a transformation, such an implementation, we weren't able to follow that through to the extent we couldn't spend time with colleagues to say, is this exactly what you wanted? How does it feel at the moment? Are there things that we should be doing differently in terms of looking at the procedures, developing the kind of the SOPs and so on. So I think that was a frustration, and it took us longer. That's the other, I suppose, significant factor. Having said that we had a competition to name the programme as One Vision, we also were very corny. Our first go live for the first phase was supposed to be on May the 4th. So there was a whole Star Wars thing about May the 4th be with you and all that kind of stuff. May the 4th became October 2020, which gives you some sense of the impact that the pandemic had on our implementation. But notwithstanding, the spirits were still very high. People could see the benefits. And notwithstanding, again, the frustrations of what COVID meant for the way that we were working and the limitations on the way we were able to engage, people stuck to the playbook. So the implementation, as I say, it took a bit longer, might have been a bit less tense at times, but the end product speaks for itself.
And then the blended team was really quite important, and I think there was an ebb and a flow really to the Channel 3 support, and we were really focused on making sure that the point at which we then left the organisation, that you were sustainable, that you were able to continue. And I think that the blended team, we'll come on to the workforce and the excitement, ambition of the workforce shortly. But I do think that blended team worked really quite well. Yeah,
we've just submitted to our what we call our Business and Performance Committee, which is the kind of formal finance committee of the board, and through them to the board, a project closed down, or programme closed down report. And one of the key reflections is that sense of staff continuity. And when we embarked on the relationship with Channel 3, we did really talk about a blended team sheet. But as you say, it was to ebb and flow. So as I mentioned, in terms of config and testing, there were other specialist areas as well that we wanted to make sure that we had the adequate level of resource. If we didn't have those within our side of the team sheet, then we clearly looked to Channel 3 to try and prefer. And you've talked about Channel 3's consultancy practice. The fact that you have always been able to offer that kind of body shopping type capability as well, that if there's somebody we need, may not be somebody that you necessarily have on the payroll, but you'll know a man who can, kind of thing. And that was incredibly helpful, particularly at points where that level of staffing continuity, we had a couple of people who were key to the programme who, for reasons that are, I'm sure, both obvious and acceptable, moved on to other roles. So when you lose that sense of knowledge, how do you plug the gap quickly? How do you avoid the gap, or the fact that someone has left not be seen as a kind of compromise to the programme? And you guys were able to step up and help us out there, even if it was only in some cases for a brief period of time, which was great, and it maintained that sense of continuity.
Great. Really great team spirit.
Yep.
Which moves us on then to engagement and motivation.
Yep.
And funnily enough, when we've circulated the invite to this webinar, there's been an awful lot of emails that I've had back and commentary on an article actually that we've just produced as well from Channel 3 around our EPR implementation experiences. That it's the hearts and minds thing. The technology will do its thing, but it's hearts and minds, and it's about bringing the organisation with you. And in fact, when we've had to work with organisations that haven't succeeded as well as others, it is about how much you've been able to engage and motivate and encourage the workforce, particularly now when everybody's, really absolutely exhausted and facing another really challenging winter. So, and we did have really strong spirit with the team, the blended team with Channel 3 and CPFT. So let's have a conversation really about engagement and motivation and how it was from the trust perspective.
Well, as I said at the start, what attracted us to you guys was that genuine sense of empathy and understanding about what we were trying to do. And I suppose the single most telling characteristic is nobody was referred to as someone from Channel 3 or someone from CPFT. Everybody was described as being part of the team.
Yeah.
And that says a lot. And that wasn't just people like myself, that was our clinical colleagues across the trust. They didn't distinguish, who was paying who. It didn't matter. Everybody was functioning as a team. And as you say, the sense of team spirit has probably developed into relationships and friendships that will last.
Absolutely.
I, for the benefit of anybody who's watching, Channel 3 do run a really good quiz. And many's a Thursday evening we spent raising a glass of wine after hours, I hasten to add, and having a bit of fun. And it was that sense of bond, the sense of kind of mutual respect, but genuine friendship and genuine understanding of what each other was trying to do that was critical to making the programme a success.
Yeah, and I think that energy spilled across then, obviously, to the May the 4th date and the lightsabers and
still
Chewbacca.
haven't got a lightsaber yet, but one of these days, maybe Santa will bring me one.
So it's absolutely critical. And from a comms and engagement perspective as well, that was part of the blended team as well, that we were able to provide some additional capacity and capability for you from a comms perspective, because I think that's an area that organisations sometimes overlook about the importance of comms in raising that spirit.
Yeah, I think that's a very good point. As I've said, we were ostensibly implementing a replacement for a mental health system. But as I say, there were large swathes of our organisation who were already using System 1, who knew this was happening. But we didn't want to have this metaphoric sense that they were kind of looking around the corner or peeking over the hedge to see what was happening. We tried to keep everybody informed. So the comms programme wasn't just about what we were doing within our mental health services. It was about the whole organisation understanding and being kept informed. And we ran a number of kind of open sessions as well with staff. We had mailboxes where colleagues could raise questions and issues if they wanted to, and the team were very open about spending time with the directorates, even the directorates that hadn't yet been they were in later phases, but were interested in what was happening in an earlier phase.
Yeah.
So spending time with them so that we could kind of prepare them, if you will, for what this was all going to mean for them as we moved into the later phases. So you're right, comms and engagement was an incredibly important piece. And I suppose, going back to my earlier point about the relationship that Channel 3 has with some key people, the person that we used was someone that I'd worked with in the past in a different guise, and had absolute confidence that Anne would be able to understand what we were trying to do because she'd worked in that environment in the past, and she knew many of the people. So the kind of tone of voice, as they say in good old comms and marketing terms, she was able to pitch it in a way that actually it was people on the receiving end felt very comfortable and informed by what was being shared with them. So it was, that was, again, as you say, an incredibly important part of the programme.
Yeah, and it wasn't really easy either. I mean, we talk about it now and we've come the other side. It was a successful implementation, but I just remember many a call with Claire about, we just need to get people, what are we going to do? So there was a real sense of, collaboration and understanding that it was absolutely critical that the engagement and motivation of the workforce was critical to the success. So moving on then to our last point, which is around optimisation and legacy. And so Channel 3 is no longer with CPFT. It'd be good to understand how that handover and departure worked, because that's always important to us, is to make sure that when we leave organisations that you're set up to succeed and that there isn't a cliff edge. And you're onto your optimisation journey now. So can you just understand a bit about what's next? Okay.
So as I said earlier, we had to defer much of the optimisation work until after the implementation, and that's now kicked off. The balanced team sheet has helped us inform the kind of level of resource we need to have in-house, and we've taken that forward. There were two initiatives that we had originally, again perhaps heroically, seen as being part of the One Vision programme. One was about the potential to create a patient portal on the back of the System 1, and the second was about could we also combine the development of an EPMA solution as part. And because of the impact of COVID, we decided not to do either of those. So interestingly, the patient portal piece is something that is going to be the second phase of the ICS, the shared care record. So at the moment we're kind of implementing a base level of information sharing, and then the next phase will be next phase will be population health management. Then it's patient portal, but it's still on the card. So the work that we've done with System 1 across CPFT, as well as I said earlier, System 1 being the kind of predominant system in primary care across Cambridgeshire and Peterborough, will stand us in really good stead there. So an EPMA, we're about to kick off a piece of work which will require much of the same sort of disciplines, resources and approach, because it's again not just about implementing a piece of technology. It will be quite a fundamental change, and I know lots of organisations have gone through that before, so hopefully we'll have the opportunity to draw on their experience as well. But given the work that we've done with Channel 3, and given the fact that we have got that strategic relationship, we're also keen to explore whether we could develop a different type of relationship with Channel 3 and yourselves, obviously on the back of how we're developing the shared care record, because one of the platform we're using for the shared care record is one that I know is also very familiar to Channel 3. And again, Channel 3 were parachuted in where this implementation of this platform didn't go as well as it might have, or was struggling a little, let's put it that way, elsewhere. So we want to draw on your experience and insights to ensure that we don't fall into the same traps.
Yeah. And are the teams sort of following some of the methodologies and lessons learned and the way that we worked with you, that has continued?
A lot of that's transferred. I mean, some of the people that we've got have now kind of consolidated their roles in our transformation team, in our digital teams and our informatics teams. Again, some of the insights that were gained there, particularly around the clinical systems piece, and the flexibility that we've now gained in understanding how we can access the information that's contained within the system. We also created an archive for a lot of the data that was previously in the mental health system. How does that then become accessible and presentable through the medium of System 1? So there's a lot of insight and learning that was developed through the implementation programme itself that's now part of the business as usual offering.
Fantastic. That's brilliant. Thanks, Scott. I think we've covered off our 5 topic areas now. Just in conclusion, at the beginning I talked about the ambition for Channel 3 is around building better lives, better care and better digital. And it'd be really helpful for us to get a reflection from you really about some real live examples of how we've worked with you and the impact that we've had on building better lives, better care and better digital. So what would be some examples?
I wish I had more time to think about this one. I think the main focus has been on how the technology, how the access to information can be made easier. for colleagues to be able to work in a very agile way. So what we do have now is, and we're sitting in a building where we have our kind of first response service, access to the information about people who may be known to our services from a mental health point of view is incredibly helpful when people are in moments of distress and they're able to, they're phoning up as they can through our first response service, which is 111, and then you press option 2 to come through here. So being able for the call handlers to have more of an insight into the history or the backstory to someone who phones is incredibly helpful, and wasn't necessarily as easy back when we had our previous system than it is now. Outside in the community, as I said earlier, investing in more of an agile infrastructure allows particularly colleagues working in mental health services in a community context to be able to access more information, and also to keep the notes associated with individuals up to date when they're still fresh in their minds.
Yeah.
I know there's an issue about the logistics of how you do that, and one of the things I learned through COVID, when we were looking to see what we might be able to do to help staff be able to do their jobs better, and we were asking for ideas. Someone came up with this novel idea which I'd never heard of before, but apparently you can buy like a laptop support that you can put over your steering wheel. Now, you don't use it when you're driving, obviously, but if you've got this image of a community nurse or a mental health nurse or working in the community, sitting trying to work on the knee. So the combination of the agile technology and the fact that they can now work in a much more comfortable way has gone down well, and the feedback's been incredibly positive about that.
Yeah, I mean, it makes me reflect really back to my days as a podiatrist out on the streets in Coventry, and I'd be sat in the car with my pen and my paper, filling out my Kerner stats at the time, the bit of paper that got fed off. So it's brilliant how technology has just evolved now, and it's wonderful really. We're working with podiatrists now, and I can see the impact that it's actually having on the care that they can provide to patients now. So great to hear that. Thanks, Scott. So I think that draws us to a close, and unless there's anything else that you want to share with us.
I'm fine. Thank you very much.
Great. And so thank you for everybody for joining us today. As I say, we'll pick up the comments and the questions that have appeared in the chat, and Scott's offered as well if you want to reach out to.
If anybody wants to channel through me to any of the team, any of the colleagues in the team, I'm sure they'd be more than happy to help out.
Fantastic. And also to feel free to reach out to any of the team at Channel 3. So thank you very much for joining us today, and look forward to our second webinar, which will be happening shortly.